All right, good morning. How's the sound in the back? Everyone hear me okay? Okay, great. Well, thank you very much for joining us for our 2019 version of ENT Update for the primary care provider. We appreciate you sacrificing your free time away from your activities and family. But we do think it's going to be really worthwhile. We're all going to learn a lot today and have a good dialogue and discussion. We've taken feedback from prior years about topics of interest, so hopefully these will be high-yield topics. We're doing a little bit different format compared to the years prior. We're going to have two panels, which is going to encourage the dialogue and always tease out more pearls that are important to you. Just a few welcoming comments. You can see our syllabus, or you should have all gotten a syllabus at check-in. This is going to be your resource for the day. It's going to have all of your slides, and you can follow along and take notes. I also want to give a special thanks to Honor Health and the Brady Conference Center for our wonderful venue this morning, and most importantly, for partnering with us to offer you CME. So you'll get 4 credits of CME this morning, and it's very important that you turn in your evaluation. We can't give you the CME credit without your completed evaluation. So before you leave the building today, please make sure you turn in your evaluation. If you don't have your evaluation yet, make sure you check up front with Glenn or Julie to get an evaluation. We will need your email address. That's going to be how you are going to get your CME credit. So you're going to get a transcript for 4 hours of CME or whatever the appropriate CME that you attend today, but we do need a legible email address and legible name on your eval. So please make sure you do that before you leave. We will allow some time during the Q&A and closure at the end to do so. Also wanted to bring your attention to a resource for future CME programs that we'll be doing. So you can go to our website, azvent.com/education, and find out about programs that we're going to be offering in the future. So to get our juices flowing, I always like to start with a little pre-test. So this is always fun. So we can run through the pre-test now and then run through it at the end and see what we've learned in the interim. So first question, we'll just do a show of hands. But all of the following are effects of tretinoin on the skin, except A, thinning of the dermis, B, diminished pigmentation, C, increased basement membrane proteins, or D, increased fibroblast activity. So all of the following are true except which one? Anybody? A? All right, we'll find out. Okay, next one. 2, which of the following is the best initial therapy for sudden sensorineural hearing loss? Is it A, Valacyclovir, B, Amoxicillin-clavulanate C, Prednisone, or D, observation with repeat audiogram in 7 days? What do you think? Prednisone. Okay, we'll see. All of the following are symptoms of group A, streptococcal pharyngitis, except palatal petechiae, cough, fever, tonsillar hypertrophy. Okay. All of the following are appropriate for management of a 2.5 centimeter lateral neck mass in a 61-year-old male, except A, CT scan of the neck with IV contrast, B, referral for ultrasound-guided FNA, C, ENT referral, or D, antibiotics for 10 days and follow-up in 4 weeks. 5, in the setting of recurrent tonsillitis, all of the following are Paradise criteria for tonsillectomy, except A, 7 episodes in 1 year, B, 3 or more episodes per year in the preceding 3 years, C, 5 or more episodes per year in the preceding 2 years, or D, 6 or more episodes per year in the preceding 2 years. Who gets their tonsils out? Except. All of the following are true except. Okay, that'll be interesting. Okay, so true or false? For severe obstructive sleep apnea syndrome, so AHI, apnea-hypopnea index greater than 30, mortality risk does not correlate with excessive daytime sleepiness. So true or false? Mortality risk does not. Okay, we'll see. All right, true or false? 90% of Meniere's disease is bilateral at initial presentation. 8, all of the following are true except 1/3 of individuals over age 65 have disabling hearing loss. Dementia risk is greater for hearing loss occurring before age 65 compared to after age 65. Only 25% of physicians routinely screen for hearing loss during a physical. Or D, on average it takes a patient 7 years to disclose that he or she is having hearing difficulties. Which one is false? Okay, well, we'll find out, won't we? Okay, which of the following statements is true regarding acute bacterial rhinosinusitis? A, purulent nasal discharge differentiates acute bacterial rhinosinusitis from viral rhinosinusitis. B, 25% of acute bacterial cases improve without oral antibiotics. C, deferring antibiotics in acute bacterial sinusitis for up to 7 days is appropriate. Or D, azithromycin is an appropriate first-line therapy for acute bacterial sinusitis. And 10, all of the following are true, except allergic rhinitis is present in over 80% of patients with asthma. B, asthma is present in up to 40% of patients with allergic rhinitis. C, dupilumab has been FDA approved for treatment of nasal polyps. Or D, mouth breathing promotes bronchodilation. All right, that's a good one. Okay, great. So we'll see how we do at the end.